Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Leuprolide. Its brand name is Eligard. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Leuprolide. We'll then touch on examples of dosing and finish it off with side effects with percentages. I'll put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Leuprolide is a synthetic gonadotropin-releasing hormone or luteinizing hormone-releasing hormone analog. It exhibits a potent reversible inhibition of gonadotropin secretion. In terms of indications or reasons we prescribe this medication to a patient, well, we may see Leuprolide prescribed in the treatment of anemia in the setting of a uterine leiomyoma. It may also be used for central precocious puberty or endometriosis, as well as the treatment of advanced prostate cancer. This would be in the setting of palliative treatment. With respect to contraindications or reasons we would not be able to prescribe Leuprolide, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Leuprolide or to any other component of the formulation. If a patient was pregnant, they would not use this medication, as well if they had undiagnosed and abnormal uterine bleeding. Now for an example of dosing with Leuprolide, in the treatment of anemia in the setting of a uterine leiomyoma, we may see a dose of 3.75 milligrams given intramuscularly as a depot injection once monthly for up to 3 months with concomitant iron therapy. Alternatively, we may see 11.25 milligrams IM injection given for one dose with iron therapy, and this would provide a 3-month treatment course. For treatment of breast cancer, we may see this used as an adjuvant or add-on therapy, using 11.25 milligrams subcutaneously every 3 months for 2 years, in combination with tamoxifen 20 milligrams orally every 5 years, and this would be an off-label indication. As with all medications, there are some side effects or adverse reactions that patients may experience while using Leuprolide, so we'll go over some of those here now. 8 to 21% of patients may experience edema, while 10% may experience acne. Up to 73% of patients using this medication may experience flushing, and 20% of patients may experience injection site pain. A rash may occur in 3 to 6% of patients, and some patients may experience increased testosterone, as well as increased serum triglycerides, which may happen at a rate of 12 to 32%. Abdominal pain and constipation are possibilities, as well as nausea, which may happen 6% of the time. Vomiting comes in at 8%, and arthralgia or joint pain comes in at 9%. Asthenia or abnormal weakness comes in at a rate of up to 18%, and dizziness at 11%. Mood swings, headache, insomnia, fever, and fatigue are all also possible side effects. The more serious side effects may include heart failure, a myocardial infarction or a heart attack, injury of the liver, or a fracture of the vertebral column. Alright everybody, that's all we're going to talk about today with Leuprolide or Eligard. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable, you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.